Depakote is a common name in teen mood stabilization, but its use is deeply complex. Its maker was sued for unlawfully promoting it for off-label use in children. What else is not widely known? Yet today, it's still frequently prescribed off-label to adolescents with severe mood disorders. The reason? For some teens, especially with mania or aggression, it can be powerfully effective. Here's a breakdown of its proven effectiveness, serious risks, and practical guidelines for safe use. So, let's address the core question. Why is Depakote even an option in the first place? It's reserved to target severe, disruptive symptoms, often after first-line treatments have failed to work. Studies confirm its ability to reduce manic symptoms in teens with bipolar 1, acting as a brake on an overactive brain. It's also used to manage explosive temper and agitation, helping to regulate the emotional responses that fuel outbursts. But this is no short-term fix. Stabilization typically requires at least 6 months of treatment to prevent relapse. The promise is clear, a significant reduction of life-altering symptoms. But what is the price for that stability? Every family must understand the FDA's most serious warnings. In a moment, you'll learn the black box risks that demand constant vigilance. First, severe, potentially fatal liver damage. This is why regular blood tests to check liver function are non-negotiable. Second, life-threatening pancreatitis. Any instance of severe stomach pain, nausea, or vomiting requires immediate medical attention. Third, major reproductive risks for adolescent girls, including birth defects and hormonal issues like polycystic ovary syndrome. And beyond the black box, there is an increased risk of suicidal thoughts, especially for patients under 24, demanding close observation. These warnings are exactly why Depakote demands a highly structured treatment plan. So, how are these risks managed day to day? The primary line of defense is proactive monitoring. Regular liver function tests, especially in the first 6 months, are the first step. Beyond the major risks, teens must also cope with daily side effects like nausea, stomach pain, drowsiness, and even hair loss. One of the most frequently reported side effects is a change in appetite, which often leads to significant weight gain. Stopping the medication suddenly is also hazardous. It can trigger withdrawal and requires a slow, supervised taper over several weeks. Between the major risks and daily side effects, consistency is a struggle. What stops teens from sticking with their treatment plan? Medication non-adherence is a massive hurdle, often driven by side effects, denial of illness, or a weak doctor-patient connection. It is also vital to know that Depakote isn't always the most effective choice. For some teens, other medications may work better. Even the pill formulation matters. The extended release version is often preferred for its once-a-day dose and fewer stomach issues. Improving adherence requires strategy. Supportive family routines and giving the teen a voice in their treatment decisions are proven to help. The right choice depends on the person, their symptoms, and the pill's formulation. So how does treatment move beyond trial and error? This is where the future of treatment is headed. New tools can now help predict how a teen will respond before they take the first pill. That tool is pharmacogenomic testing. It analyzes a teen's DNA to find markers that affect drug metabolism and side effect risk. Remember the severe liver danger and adherence-killing side effects? Genetic testing offers a potential roadmap to minimize those risks. This connects back to the very beginning, the controversial history of off-label promotion. This is how responsible off-label use happens. The guidance on Depakote is about synthesis, harnessing its proven power by actively managing its dangers with personalized tools. Ultimately, Depakote is a powerful but demanding medication. Its success depends on a strong partnership between the doctor, teen, and family. The decision is always a careful calculation. Do the potential benefits of stabilizing a teen's life outweigh the serious, documented risks? Be empowered. Ask your doctor about the black box warnings. Discuss a clear plan for side effect management and adherence. Confirm the schedule for mandatory blood monitoring. Informed consent is your most powerful tool for a safe and effective treatment path.